children grow up fast.
As parents and doctors, it's our responsibility to ensure they also grow up healthy and well protected,
especially against pneumococcal illnesses.
In our medical journey, we form deep bonds with long-term patients, advising them on health choices. Many of us recommend these vaccines to parents as their infants reach the eligible age, knowing its significance against pneumococcal diseases. Parents rely on our expertise. We know the science and the real-world impact of our advice, and it's our responsibility to ensure they understand the vaccine's advantages.
When I discuss with parents, I prioritize clarity and understanding. I explain that without the pneumococcal vaccination, their child is at risk for the diseases like pneumonia, meningitis, and bloodstream infections. If necessary, I go deeper into severe complications, emphasizing the vaccine's role in preventing life-threatening conditions to make the best decision for their child.
Indeed, I've witnessed such heartbreaking scenarios. It's a whirlwind world we live in 2023, and with everyone running tight schedules, vaccinations can slip through the cracks. I don't point fingers, life happens. Yet, the consequences can be quite serious, which is why I persistently stress the importance of vaccines on schedule. It's not about the repeat visits to my office clinic. It's about ensuring the children are safeguarded as they should be.
Parenthood brings a new dimension to my role as a doctor. Every time I recommend a vaccination or a treatment, I put myself in the parent's shoes and think about how I would feel if it was my own child, and how pneumococcal conjugate vaccination have played an important role in ensuring their well-being.
Absolutely. It's a commendable move by the Ministry of Health Malaysia to include PCV into the NIP. Here are some key highlights about the pneumococcal conjugate vaccine. It is included in our national immunization program for routine immunization and is available to all infants born from January 2020 onwards. And now, children born in 2018 and 2019 can benefit from the pneumococcal vaccination CHUPP campaign. And the vaccine offers epi-driven serotype coverage and proven effectiveness, make it essential in battling pneumococcal diseases. And the integration means broader access for Malaysians to this essential vaccine, especially for children below 5 years of age where pneumococcal disease is more prevalent.
Absolutely essential. The catch-up dose is crucial for children born in 2018 and 2019. I recall a conversation with a patient who's been with me for years, discussing their child's vaccination. They acted immediately, making an appointment without delay. This underscores our role as healthcare professionals. We must emphasize the importance of vaccinations. Our task is to direct our patients towards these vital services, protecting their children to the fullest.